And welcome back. I'm Mabel, Jong. Thanks for sticking with us. We're at our last interview of the day here at the World Healthcare Congress, and I think we saved the best for last. We have here in the studio an entrepreneur who started out as a physician and then ended up becoming an innovator, an entrepreneur, and sought his first funding on that show, Shark Tank. So quite a journey for our next guest. Nikhil Pooviah is co-founder and CEO of CancerAid, and he's joined in the studio by Elizabeth Maribito, executive director at Cedars-Sinai Medical Delivery Network, based out of Los Angeles. Welcome to you both.
Thank you.
Thanks, Mary.
Well, it's one of those cool stories that really you just want to know more. And Nikhil, you started out, as I mentioned, as a doctor, and you came up with a company called CancerAid with two other friends. And it's very interesting that you actually went on TV to ask for funding from that from the Shark Tank folks of that show, Shark Tank. How did that all happen?
Yeah, so for me, CancerAid started 3 years ago. We designed an app to help cancer patients navigate through their journey. So we've very quickly become the #1 cancer app in the world, and what's exciting now is we have evidence to show that patients who use our app can actually live longer. Going on a show like Shark Tank was great for us because it allowed us more marketing to spread our key messages, but it was daunting, but quite an experience.
Wow. So tell me about CancerAid and why cancer?
Yeah, so I've got a background as a radiation oncologist. I worked for 4 years and I saw a lot of the issues that patients and their families were going through. So we designed our app to help address a lot of these issues, and we believe we help patients address the fact that they feel very anxious and confused with the amount of information that they get given. Going through treatments, they have a lot of medications and appointments, and the fact that patients can feel very isolated in their journey. These are all pain points that we wanted to address with our app, and that's kind of how the initiative started for me.
Okay, and then enter Cedars-Sinai. Elizabeth, you know Nikhil through this app. Why was this particular invention interesting to Cedars-Sinai?
So I think what interested me most about the technology is the ability to leverage the technology to, one, better communicate with patients, 2, better coordinate care with patients, and then 3, meet some of the requirements around ACOs and the oncology care model with CMS that I think we've all been working to innovatively meet. But the other piece of it, I think, if you look at any tech startup, is the energy of the team and the experience of the team and the commitment of the team. And I think that Nick and his co-founders really demonstrated that they had a passion for their project. It wasn't just that they wanted to have a tech startup. It was a problem that they were really trying to solve because they were passionate about it.
Okay. And Elizabeth, at Cedars-Sinai, do you have an innovation lab of some sort that is looking for different ideas that entrepreneurs are coming up with,
Sure.
and you help them develop them? Or tell me about that.
So we have a tech accelerator. Every year we take a class of 7 to 10 companies that work their way through our accelerator, and we give them access to clinicians, executives, frontline staff members who can help them better develop their product and bring it to fruition. Usually it's products and tech apps or technologies that are in the earlier stages, so they're looking for an opportunity to build their technology and what the actual applications are. They're looking for focus. But we've also had technologies that are well developed that are looking to break into healthcare from another industry.
Mm-hmm. Okay, back to your app, Nikhil. What does it do? I mean, what do cancer patients get support for when they come onto your app and use it?
Yeah, we think of CancerAid as providing 4 key features for a patient. When I would see a new patient in clinic, I discuss a lot of the information verbally, but I don't necessarily provide patients with anything written. So CancerAid allows patients to take our app home, read the information at their own pace, and they can share it with their family. Mm-hmm. For those patients that are going through treatments, we provide them an organizer so they can better manage their personal experiences, mm-hmm. as well as a symptom journal so they can record their symptoms, side effects, and complications. Mm-hmm. For care teams in the hospital, like Liz was mentioning, we have a feature called Champions, which allows patients to actually connect with a support network of personal champions and medical champions. But the stickiest feature of our app is actually our community. We know that living with cancer can be a very isolating experience for many, so we've created a newsfeed similar to Facebook, LinkedIn, and Twitter. We have patient stories, caregiver stories, motivational quotes, cancer news, cancer research, and cancer tips. This by far gets the most use out of all the patients that are using our app.
Are you finding, to the both of you, are you finding that getting that kind of support really makes a difference for cancer patients? Liz, why don't you take that?
Oh, absolutely. I think that there are significant benefits to having a stronger community as well as education at your fingertips. But certainly the other piece that I think CancerAid is solving is once you leave the walls of the healthcare institution, who is your support and how do you communicate with them? And increasingly we've moved into a technology-driven environment or a technology-driven culture, if you will, and needed a tool to solve that because people aren't going to traditional support groups anymore. People aren't wanting to drive across town at 6 o'clock at night to talk about their cancer with a group of strangers. We hide behind technology, and it's also easier to talk to people about some of your personal struggles through technology. So,
what kind of support can you provide Nikhil's company through his affiliation with Cedars-Sinai?
Sure. So we're working on a pilot right now to help solidify and refine that feedback loop between the clinicians and the patients and their own symptom management and tracking so that we can ensure that at the right points the clinicians are intervening early. Nick was inspired by an ASCO publication. What was that, a couple of years ago?
Last year.
Last year.
Yeah.
Last year, maybe you can talk a little bit about that, and I think it helps kind of illustrate what we're trying to accomplish.
Yeah, so what we do is we provide our app free to patients and we license the technology to health systems like Cedars-Sinai. So care teams at Cedars-Sinai, like doctors and nurses, will have the ability to look at patients who enter in their symptoms on our app in real time directly into the EMR workflow. So why that's very important is, like Liz mentioned, is we can actually intervene earlier so we can actually reduce costs from patients coming back into hospital for unnecessary reasons. Okay. So we're the first cancer app to actually do that integration in the world. It's a very hard step, but we wouldn't have been able to achieve that without going through the accelerator at Cedars-Sinai.
Are there other cancer resources that are accessed via smartphone?
There's hundreds of cancer apps. So
what we makes yours so different?
Yeah, so it's actually that feedback loop. So we are the first cancer app to integrate into the electronic medical record. We've done it for the first time at Cedars-Sinai with Epic. So that's the key differentiator, but where a lot of our competitors have failed is they haven't identified who the end user is. So designing a cancer app for a 70-year-old prostate cancer patient isn't the best solution. He's not going to use an app. But if you design it in a way that his daughter or son who manages his journey can actually use the app themselves, you're better placed to actually secure that kind of user. So that's kind of where we say we've differentiated. We are the only cancer app that has a founding team of doctors that I'm aware of, so I think that certainly helped as well.
Yeah, that certainly seems very unique. In addition to the funding that you received from your Shark Tank appearance, you've also closed other rounds of funding. Where do you take the CancerAid app from here? Yeah,
so we've raised $2 million to date. That's allowed us to develop the app and take it to market and sign up some early customers. We've been on the TV show Shark Tank, and that allowed us some great channels to leverage into the US market. What we want to do now is to actually replicate some of the work we've done at Cedars-Sinai with other health systems. So we know that we have patients at 80 of the top 200 US health systems already using CancerAid. So what we want to do is similar to what we've done at Cedars-Sinai is provide that feedback loop so that care teams can provide better care. So we're doing a seed investment round right now to actually reach and invest in a few more different aspects of the company. One is to actually have a sales team here on the ground to meet some of these health systems. Certainly we want to invest in marketing so that patients are using the app before we go to a hospital, and having that integration team here on the ground will also help speed up the implementation process. Other than your original affiliation with cancer through your work as an oncologist, is there a personal connection to this particular illness? Yeah, so my grandfather has leukemia, so myself and my mom have been like his personal champions. He's lucky in that he hasn't had too many issues with his diagnosis, but certainly for us as a family, having that kind of rally and support with a tool like CancerAid is certainly quite fun to use. Other than that, like, you know, I've had a lot of friends that have experienced, you know, connections with cancer. Mm-hmm. For us, we believe we're creating something really cool, being that first cancer app to have that feedback loop. One of the reasons we became a doctor was to, you know, help patients. So CancerAid allows us to help even more patients than ever before.
All right, Nikhil Pooviah, Elizabeth Maribito, thank you so much for your time today, and good luck to you.
Thanks, man.
Thank you.
And thank you to you for joining us today. Thanks for sticking with us. We have a lot more content that will begin tomorrow morning bright and early at 9 a.m. I'm Mabel, Jong. Thanks for watching.